other vital organs in the body like heart, lung, kidney, brain, liver is a vital organ involved in multifarious activities. It has multiple functions. It manufactures a lot of nutrients and proteins. It metabolizes glucose. It provides energy. It works as an immunological organ to give immunity to the body. It excretes a lot of toxins and so on. So if anything damages the liver, it has an effect all over the body. There are a number of things which can damage the liver, which includes virus, alcohol, lot of drugs, toxins, the anabolic steroids, the supplements which the young used in the gym, and lately the very important epidemic which has taken place is the fat getting into the liver and damaging the liver, so-called fatty liver or non-alcoholic steatohepatitis. All these can cause temporary, transient or a permanent damage to the liver. So we need to be aware of that and we need to be conscious of that so as to avoid all this. How do we avoid all this? For certain things we know how to avoid it, that is, avoid misuse of alcohol, avoid misuse of medicines and don't take unnecessarily, and if necessary take under the physician's guidance. When we look at the viruses, there are two broad groups which are waterborne and which are blood-to-blood transfusion, blood-to-blood exchange. So for that we need clean water, clean sewerage, safe blood, safe sex because certain viruses are transmitted through sex, and safe disposables, operation instruments and so on. So friends, on this World Hepatitis Day, let's all pledge together to take care of all these elements, and in addition to have healthy lifestyles, do good exercise, do take balanced foods and avoid excess of fats and so on. So let's pledge that to have a healthy body, we like to have healthy liver, and for that we follow healthy lifestyle.
Why do we need to increase the awareness amongst masses for hepatitis? Answer is simple. This is a global issue and we cannot win over this unless we increase the awareness of hepatitis universally. What is important to understand is by the time somebody develops symptoms and signs of hepatitis, they're usually too late. So we need to know how these conditions are transmitted and how we can prevent it. The two common causes of hepatitis today that I would say is viral hepatitis like AEB, C, and fatty liver disease due to lifestyle issues. For viral hepatitis, A and E spread through contaminated food and water, and hepatitis B and C spread like HIV, that is through contaminated blood products, needles, instruments, equipments, dialysis equipment, etc., and through unprotected sex or from infected mother to a baby. So, dear friends, shy away from sharing your toothbrushes, razors, nail filers with others. Be always very careful when you have an exposure to a needle. Let it be an injection or a dental procedure or any tattooing, etc., ear piercing. So these can increase your predisposition towards hepatitis. And of course, the next important cause, which is rather emerging as an epidemic over hepatitis B and C, is fatty liver disease. And you can prevent that by a good, healthy diet, preventing obesity, and good lifestyle, good exercise and activity. World Hepatitis Day, here I am wishing you all to spread this awareness to all.
Hepatitis B is a preventable disease because in India at least 100 every 3 are hepatitis B positive, at least 0.5 to 1% is hepatitis C positive. If it is detected early, it can be treated early, and then the prevention of the complications like liver failure, liver cancer is prevented. And then hepatitis B, if you do a mass vaccination, if all the children are vaccinated, probably just like polio, we can just eradicate this virus from now onwards. And hepatitis C now is completely curable with the good medications what we have. In India it is very easily affordable thanks to the Indian government. Now the same medications which are expensive in US and Europe, it is available for very little amount, maybe 15 to 20,000, 3 months of treatment is over, whereas the same thing in Europe or in America costs huge amount of money and lakhs together money what they have to spend. And coming to the hepatitis B and hepatitis C, people should not be stigmatized because hepatitis B and hepatitis C, they think that they cannot get married, and the females, they feel that pregnancy should be a problem. I think this stigma should be completely removed from the society. Hepatitis B can be treated even during pregnancy, and then so that we can prevent the baby having hepatitis B. And then hepatitis C, even if it is there, nothing to worry. Now it is completely curable with the medicines what is presently available in India. That's why the whole information what I would like to share is hepatitis B and hepatitis C. We have very good treatment and it can be very well treated, number one. Second, hepatitis B vaccination is mandatory for all children so that the next generation doesn't get the hepatitis B related liver disease.
These are very important causes of liver diseases, and actually the number of deaths due to hepatitis viruses is almost comparable to deaths due to tuberculosis or malaria or HIV. We need to be aware and we need to be taking preventive measures. So first and foremost is to get every child vaccinated for hepatitis B, because that is the sure shot way of preventing hepatitis B. If there are any abnormal liver results, we should get ourselves checked for these viruses. Having a good, safe, sanitized water is something which is very, very important, because safe and good water supply would prevent hepatitis A and E. The other thing is avoiding abnormal lifestyles like too much of alcohol, fatty liver, diabetes is also very important, because these add on to the risk of viral hepatitis related liver damage. So in short, get yourself vaccinated for hepatitis B, check for hepatitis viruses if there are any abnormal liver tests, and look after your liver very well.
As we all know, hepatitis or inflammation of the liver can result from multiple insults, but the commonest is infection by hepatotropic viruses like hepatitis A, B, C and E, of which A and E are fecal-orally transmitted, usually cause acute hepatitis, come in epidemics, and fatality rate is reasonably low, with acute liver failure resulting in less than 1% of the subset of infected people, especially in a specific subset depending on which virus it is. Of the two viruses, vaccine is available for hepatitis A, and I would urge all those who are unvaccinated up till now and do not carry antibodies for hepatitis A to get themselves vaccinated. The other two hepatitis, namely hepatitis B and C, may cause acute or chronic hepatitis, but chronic hepatitis is much more commoner. The two together account for more deaths in India than tuberculosis and HIV together. Majority of the people who are infected with these viruses are not even aware that they are infected with the virus unless and until they develop a significant liver damage. So, we need to create awareness amongst people, not only to prevent prevention, but also to get themselves checked and to get themselves vaccinated for hepatitis B. Unfortunately for hepatitis C, we do not have a vaccine yet.
28th July is celebrated as the World Hepatitis Day, and it's important that we create awareness about it because viral hepatitis is a silent killer. About 350 million people globally are affected by viral hepatitis, and the important part is that 9 of 10 people are not aware of this condition, and that's why we need to create awareness about this. There are various types of viral hepatitis: hepatitis A, B, C, D, and E. Hepatitis A and E are usually spread through contaminated water and food, and the prevention can be by improving the general sanitation and hygiene and use of personal hygiene measures like washing of hands after using the bathroom. These simple measures in the society can prevent and easily treat these conditions. The other problem is hepatitis B and hepatitis C. These are blood-borne diseases and can lead to liver cirrhosis and liver cancer. Hepatitis B is very easily preventable by vaccine, which is almost 98 to 100% effective. The vaccine also prevents the perinatal transmission from mother to child. And there is very effective treatment also available which can reduce the incidence of cancer or liver cirrhosis. Similarly, hepatitis C can be also very well treated with medications. So you see that these viral hepatitis, the various conditions can be easily prevented and treated if proper diagnosis is done on time. And the awareness by observing the World Hepatitis Day aim to do just that. By preventing this viral hepatitis, we can reduce the incidence of liver cancers and liver cirrhosis and help a lot of people.
Hepatitis or liver inflammation or infection is usually caused by 4 types of viruses: hepatitis A, hepatitis B, hepatitis C, and hepatitis E, out of which A and E are self-limiting waterborne infections. But hepatitis B and C are chronic infections, and it causes a major health burden to all countries and all populations. We need to be aware of hepatitis B and C because majority of the time they are silent, and unless we check for and screen, we will not know, and by the time the symptoms come, it is very late, and we can transmit this this virus to people around us if we are not aware of it. So screening is important to prevent damages done by these viruses presenting lately and to prevent infections to others. Screening and treating each patient and people around them is very important, and awareness about this is very important to prevent the overall burden of the disease and thus preventing the reservoir from which the infection transmits to other people. And if we are able to do this continuously by screening, treating and vaccinating vulnerable population, we will be able to reduce the number of cases in population and finally eradicate these infections.
Hepatitis is one of the leading cause of deaths globally, accounting for 1.34 million of deaths, which is as many as HIV, AIDS, tuberculosis and malaria all together, and thus it is considered to be a major public health hazard. There are 5 main types of hepatitis viruses: hepatitis A, B, C, D and E. Viral hepatitis A and E are causes of acute hepatitis, with mortality of around 0.5 to 4%. The world is currently facing a new outbreak of unexplained hepatitis affecting predominantly the children, and that does not belong to any of these 5 viruses. Most acute infections are self-limiting and they even go undetected occasionally, but in some cases it may lead complications and can be fatal. In 2019, estimated 78,000 deaths were worldwide due to complications of acute hepatitis. On the other hand, hepatitis B, C and D causes chronic hepatitis that lasts for several decades and ultimately leads to cirrhosis or liver failure. These are responsible for over 1 million deaths per year from these causes. These 3 types of chronic hepatitis are responsible for over 95% of chronic hepatitis. Despite this severity, currently 90% of the people living with hepatitis B and 80% with hepatitis C are not aware of their status. 42% of the children globally
have access to hepatitis B vaccination. Out of nearly 22.6 million children born in India every year, over 9 million will acquire the infection in their lifetime. While we have the guidelines and tools to diagnose, treat and prevent these chronic infections, these services are often limited resources. They are available only in tertiary care and specialized centers. So, on World Hepatitis Day 2022, WHO is highlighting the need for bringing this healthcare closer to the primary health facilities and communities so that the people have a better access to the treatment and care, no matter what type of hepatitis they are suffering from. I can't wait. Hepatitis can't wait. This is a new campaign, new theme to launch the Viral Hepatitis 2022. The aim of this theme is to highlight the need to activate the fight against viral hepatitis and the importance of testing and treatment to the real people who need it. This campaign will amplify the voices of people affected by viral hepatitis, calling for immediate action and the end of the stigma of the discrimination.